morning, everybody. Welcome back to another Safe Together, Strong Together update. With me, as always, Dr. Bronson, co-chair in all of this work. We come to you today with kind of a retrospective, a look back on a semester that has been a learning experience for us all. A great opportunity for us to pause for a moment and really look back upon the semester that was. Maybe highlight some of those things that went well, reflect on some of the things we need to do better. And really then, I think we're going to ask you all to weigh in and continue to help us get better. So starting off, I think we want to remind ourselves where we started, right? President Foster, back in March, I think laid out a pretty clear marker for us all, letting us know why we are going to return to campus, and that is this moral imperative. We know that 2 in 3 of our students are either low income, first in their family to go to college, or students of color. We know that those students really struggled online last spring, and so as we reflect on that, we reflect on our mission, we reflect on the charge from the president. It was clear to us that we had to come back to campus. And so that's where this all started, circling around this moral imperative. The other imperative we know is historically, education is what has gotten us through pandemics like this, right? It's what's allowed us to solve things like polio and smallpox and cholera and all the challenges we've faced over humanity. So while this coronavirus is in fact novel, this challenge facing our world really is not, and education, we think, is the path out of that. But Dr. Bronson, lots of puzzle pieces that has helped us do that, right?
That's right.
What about students? What was their role in all of this?
Absolutely. Well, central to our why has always been students. And I think watching that unfold over the semester, I've never been more proud to be a Maverick and watch our students really rise to the occasion. We saw maturity beyond years. You know, freshmen that are coming and having their first college experience, and they found ways to continue to have that college experience even with social distancing, even with some new rules and regulations that on the surface may not have felt so good, but they found ways to continue to be resilient.
Yeah, they had a different experience than most freshmen, right? But you know, I've heard you and others talk about this being a more than year, not a less than year. And some of those opportunities for students that were frankly more than, right?
That's absolutely right. You know, I think about the innovation that just happened around a year that, you know, a lot of people could have said, oh, we just need to stay in and stay safe and not do anything. And our students were out there and not only showing up to be, you know, testers at our test site and sampling site. Our nursing students that weren't able to do some of their clinical rotations were able to get their clinical hours by being our testing samplers, and they showed up every day in the snow and in the heat, and they were there, which is incredible. We had engineering students who showed up and were willing to help us create our wastewater structures. And not only that, they were able to be there on the back end, helping us crunch some data and know what to really do with that information, which was incredible. And then we had our RAs, who I think really stepped up this year. You know, and I think about the leadership that happened to not only, you know, do some of the mask enforcement, some of the things that weren't as fun. I think some of the peer culture that really it was a bunch of folks saying, hey, we can do this, and we can do this together. And they created music videos and safety dances around some of just the really cool things that were still happening here on campus. Yeah,
putting some of those, you know, we talk a lot about experiential learning, but my goodness, what a great opportunity this semester was for just that, right?
Yes.
But it wasn't just students, it was also you as parents that helped us get better. I mean, I think about the tough questions that you asked time and again, which frankly, at every turn, helped us to get better. You know, I think back last summer as, you know, we're all putting in the hours and trying to solve all these problems, but of course we didn't anticipate all the problems. And you, parents, really, by asking good and probing questions and frankly being patient with us, you really helped us get better. And you gave us suggestions, you asked tough questions. And I mean, I think about a lot of the testing logistics that, you know, I mean, we've never run a testing site before, and, you know, the very difficult but detailed and probing questions we got really helped us solve problems better, stay out in front of issues, and do that. And you also supported your students. I mean, you know, you think about how difficult this semester we knew was going to be
That's right.
challenging, but it was also this great opportunity. And so you kind of went out on a limb with us and said, no, we're going to go in this thing together, and we're grateful for that, because I think your support as partners with us really gave those students an opportunity that they would have had otherwise, and that frankly most students around the country did not get this fall. So
That's right.
your work as parents was meaningful, continues to be meaningful, and so appreciate that work.
Absolutely. There was a lot of trust and a lot of confidence that you were able to not only give to our students, but give to us, and we so appreciate that exchange. And as we have said so many times, it has taken so many people rowing the boat with us, and you were an integral partner in being able to make this a successful semester.
Dr. Bronson, your day job around here as a professor, I think about the backbone of this institution and the work in the classroom. Talk to us for a minute about some of what you saw out there in the classroom.
Yeah. I've never been so proud of all the professors at this university and their creativity and willingness to go into the classroom as warriors too.
Yeah.
Because it took a lot of bravery to say, we can do this and we can do this safely together. But I think really some of the cool things was some of the innovation. I think of Dr. Darren Kamstra and his willingness over the summer to spend a lot of time looking at studies on how to be able to not only have music and performance done in a safe way, but really getting down to the nitty-gritty details to make each instrument safer. Who knew, that doubling over some pantyhose on an instrument would make it so that we could do that safely in an environment together. And
then maybe at a time, right, where we didn't have a blueprint or a playbook for this, right?
That's exactly right. Yes, I mean, you're thinking about all of the pieces that we were learning about coronavirus over the summer, and we had a bunch of really dedicated faculty who were saying, yeah, I'm willing to not only learn about it, but willing to make that next step to be able to have my students back here and continue to do the things that we do well in the classroom, which is really cool.
Yeah, Mia, I echo your comments. I think being proud of the institution is something I have felt a lot this fall, more than maybe usual. I mean, looking at our colleagues and the work they've been doing, looking at our students and their commitment. I mean, we sort of say it tongue-in-cheek sometimes, but students foregoing a lot of the kind of just freedoms in their social lives that they did in exchange because they understood the stakes. And I agree with you, Mia. I'm really proud to be part of this institution.
Yeah, I think one of the cool things too is we looked at pivoting, to being online after Thanksgiving, and I'm hearing from so many students that experience has been really good. And I think about the work that faculty have done over the summer through the fall to prepare for that pivot, and I think it's just an amazing testament to just the really dedicated folks that we have here at the university.
Yeah, I had, we had written some notes earlier before about this idea, but the number of staff and their dedication and buy-in to this, last March, and frankly ever since then, we've had a variety of staff whose day jobs were changed dramatically by this, and rather than sort of folding their arms or going to find a different job or something like that, they said, well, put me to work somewhere else. How can I help be part of this solution? And I think of running a 4-lane mass testing site with all these athletic coaches whose day jobs got changed dramatically for, different times. And they're out there helping direct traffic, helping to check people in, really helping us to test in a way that we would not have been able to do otherwise.
That's right.
I think of all the IRIS advisors and financial aid advisors and the people that have just done unbelievable work reaching out to students, making sure that they're getting the support that they need, financial support and academic advising and those things that, as we're all feeling a little overwhelmed, how do we make sure we go that extra mile and touch base? And such a credit to the work of those staffs. I think of student life and figuring out how are we going to have fun and program and, the Stay Together, Play Together initiative, right? What a great way to keep those family units close. And finding opportunities to do things together that are fun, and concerts and all the different activities that they planned on to keep students here and to keep students safe, right?
Yeah, there was a lot of rowing that happened internally here to keep this boat moving forward, and I also think about all of our external partners, and really the folks that jumped in that aren't usually in our boat in such an intricate way. Maybe you want to talk just a little bit about who those community partners were and just the role that they played in our success.
You know, we've had a long time, I mean, not just in your physician's assistant program, but of course in the nursing programs and others, we've had this long-standing relationship with our local hospitals. Grand Junction, of course, being a healthcare hub, we have this great blessing to have, you know, community hospital, St. Mary's Hospital, you know, Colorado Canyons Hospital, our VA hospital, all these medical partners, just an absolute trove of experts and folks who live in this community and have that expertise that we're able to bring it to bear.
That's right.
I think of Dr. Reeder, who's now here at CMU, but a longtime physician in town, who was able to help support us in a lot of the research and literature work. I think of, you know, Dr. Tobin and Dr. Lee and, you know, all the folks, you know, Aaron Minerath over at St. Mary's, all these folks who were just really in the boat with us. And they weren't getting compensated for this. This was just something they said, yeah, you guys are clearly going to be a key part of our community response. We're in. Can't say enough about our partners at Community at St. Mary's and in the healthcare community more broadly. Mesa County Public Health,
Yes,
my goodness, right?
a huge one, absolutely. You know, I think about, you know, over the summer, they were here, feet on the ground, looking at all of our spaces,
That's right.
getting to know our campus, understanding all of the intricacies of what was going to be able to make us successful, and I so appreciate all of that.
I think the other component that we brought in was our economic development partners, the Chamber of Commerce, and a variety of those partners that, you know, the President Foster early on, I think, recognized that the business community and the, you know, the university, we've had these long-time partnerships, right? But I think at the President's behest, we went out and said, okay, we're going to figure out how to get masks distributed around Main Street and all these other places, right? Just a few weeks ago, you know, our credit to our marketing team helping put together a community PSA to remind folks we can do this together, and here's some of the basic things we've got to do to keep each other safe, right?
That's exactly right.
The third-party partners that we've been able to work with through this process that have given us help, you know, you don't do these sort of big things without support, right?
That's right. Yep. It has taken a ton of folks, and I think of, you know, Gary Community and, you know, what has come out of Coachella, Colorado, and the connections that they've made for us, not only here in Colorado, but then also, you know, in other states, not to mention MIT and Harvard, who've gotten to hear from many of those partners, just the way that they've been able to support us with technology that we wouldn't have had without those partnerships.
Yeah, I think of just even the difference between helping us select the right labs to run tests through, and the difference between getting a test result in 5 days and 36 hours, which was just dramatic. And it remained that for us all semester long, despite national you know, backlogs and everything else, that we were able to get students tested quickly, regularly, and turn those tests around.
Absolutely. And I think about, you know, Darwin Biosciences and, you know, our ability to be able to bring LAMP testing here, and what an important tool, being able to have same day test results for our screening, just some of those big integral pieces that have really added up, I think, over time to be able to make us successful.
Yeah, you mentioned the engineering faculty, Dr. Carrie Schultes and Dr. Kelly Bevel and all, you know, so many others who just were helping us build that out. But then, of course, on the microbiology faculty, you know, I think of, you know, Dr. Megan Sherbino and Dr. Kyle McQuaid and Dr. Zainab Zoe and all the others that helped us build a lab to be able to turn these tests in-house in hours, not days. No way we do that without the kind of expertise and help from our team here on the faculty.
Absolutely. You know, I think we talked a lot about all the people on the boat, but certainly leadership and having President Foster leading the way in all of this, I think needs mention. You know, I think we have been able to be here today because of his willingness to say, we're going to do this, and there's a way forward for us to do this safely, and just appreciate his leadership at the helm that's allowed us to be here.
And frankly, you know, between the president and our board, they could have said, let's take the cautious route, let's take the easy road, but they didn't, and I think we can all be grateful for that. We did a lot of testing.
A lot
of testing. I just asked Emma Lienerman before we came over here to take a quick look and update those numbers. We've now crossed 25,000 tests that we did for CMU, and another 6,500 tests in the last couple of weeks that we've done for the public.
Yeah.
Really remarkable stuff, and we've done that, of course, across a variety of things. We did, as you mentioned, the RT LAMP assay, the rapid saliva, the PCR saliva test,
Yeah.
which I think we were one of the first to adopt that and that quick turnaround and how much that was able to help us. And then, of course, the nasal swabs, which we have done a lot.
We've done a lot of those.
We've done a lot of those
Yep.
with the help of all those nursing students. The technology that has allowed us to really help stay ahead of these curves, of course, that credit is due to so many others, but
Yep.
my goodness, how much that has helped us to be able to navigate that. And it seems obvious that will be part of our future moving forward, right?
That's right. I think when we're looking at, the future is now and our optimization to be able to think about spring, we are going to stay with those things that did work really well. And I think when we think about what those were and what those looked like, I look at our testing strategy and the importance of ensuring and having the understanding of knowing what COVID looked like on our campus was so important. So knowing that COVID burden, testing is going to stick around. We're going to be able to be nimble and look at, are there new technologies that are coming down that are going to allow us even quicker turnaround time and even more efficiency around that? We will continue to sort of march down those tracks, but for now we know that we can build a big testing site. We can run a lot of people through it in a short amount of time, and maybe more importantly, reach out to those folks with our contact tracers. We talk about the work of Michael Hughes and Dr. Kristen Human, just in what they have done to build an incredible team that can be the wraparound phone calls to all these folks, not only if someone tests positive, but also green and red screens, and how important that technology was, and being able to ensure that we had safety here on campus.
Tricia, I want to thank you for pointing out some of the areas where we're falling short, where we can continue to get better. I think one of our commitments from the get-go has been to do this in humility, recognizing that we don't have all the answers and that we probably are going to fall short in some areas. And so the way we get better and improve is by you helping us point those out. And so, Tricia, thanks for doing that. I would also tell anybody else who's watching, take a moment and reflect on this semester, some of those areas that went well for you or your student, and those areas where you think, if we had it to do over again, we maybe would do things a little bit differently. What are some of those areas that we can continue to get better and grow? Send us an email if you have a minute over the break, safety@coloradomesa.edu. That's safety@coloradomesa.edu. Send us a note. Let us know how we did. Let us know what we can do better. More importantly, I think as we are committed to figuring out this continuous improvement, how we get better. One of the things we learned, talking about lessons learned, I think that I don't know what I was expecting, but we've now done a little bit of work to understand the experience of students. You led that contact tracing effort, and what were some of the things that you saw in terms of student experiences for those who maybe did get infected with coronavirus?
Yeah, absolutely. I think we learned a lot about, you go into isolation. We all think about isolation and what isolation and quarantine really means, and figuring out pretty quickly that was not a great experience to have to be in a room by yourself and knowing that you have 10 days of that. And I really give a shout out to the Residence Life team and really recognizing that early on and saying, who are other community partners that we could bring in to make this experience a little bit better? Maybe talking about the partnership with Young Life and what that looked like and being able to support some of our students.
Yeah, for those of you that have watched this, we brought a couple of our students in early on who were among the first positive cases on campus to get their perspective, say, what was your experience like and what did we learn from it? And one of the things we learned was a lot of our students didn't feel particularly sick, but it was really hard on them emotionally, and the isolation of it was pretty tough on them. And so working with some of both Residence Life and, as you said, one of our campus ministry organizations to go do care packages and stop in on those students and really trying to find ways to make sure that it isn't just food and medicine. There's human contact and games and things to keep students engaged and bring a little joy into that, what can be a kind of a tough isolation period.
Absolutely. And our mental health team here on campus was really responsive in ensuring that students had access in a lot of different avenues to be able to make an appointment, to be able to still be able to be seen and be supported by our counselors here too.
Okay, so we also did a little bit of I talked to you about the testing numbers. We did a little bit of work around this idea of what happened in the community and what happened here on campus. So we've started to chart that out a little bit. Numbers are pretty interesting, and they kind of indicate a little bit of the story. We don't have all the genomic sequencing, so we don't know for a fact exactly how this played out. But what it appears that we were able to keep our numbers really low as the community was, but as you see those community numbers rise, we're not impervious to that. And a great reminder as we look at some of these charts and graphs and analyze the data and what has happened, that what's going on in the community will affect us and vice versa. We have an obligation and a responsibility to the broader community to make sure that as our numbers move around, that we're really being thoughtful and careful to ensure that we don't see those numbers grow among high-risk populations.
Yep, that's exactly right. We really looked at and have thought a lot about infrastructure and what safety infrastructure is going to be important to campus, but we also have realized, I think, in this process how important continuing to expand that out to our community is going to be for continued success. And so, I think the testing site is one way that we're already thinking about making sure that those technologies also get out to our community. But as we start thinking about vaccinations and what that's going to look like, although we don't have a clear picture on what that's going to look like for our community and how many vaccines are going to be available and the timing, we're continuing to stay up to beat on that and update it as much as we can. But we also look at the infrastructure that we've built for our testing site, and that is easily something that we could transition to being a place for vaccination. So think about some of that infrastructure and some of the things that we built, and it's not all for naught. There are things that we're going to be able to utilize those things for in the future.
Yeah, you mentioned the testing site, and of course that's been in some ways you think, well, how else would you use a testing site but for testing? And you pointed out the obvious, which is that's likely going to become a site for vaccinations as that becomes available. And while we don't know exactly the contours of what that looks like, we're reading the same newspapers you are in terms of, I think, our first frontline healthcare workers like yourself and others. We'll start seeing those here in a couple weeks. But in terms of what that looks like on campus, we don't know. I think President Foster has been pretty clear that we do not anticipate a mandatory vaccine. I think our desire is, as an educational institution, that we do a good job educating people, that we help them understand exactly what the vaccine is, exactly how it was developed, and what the advice of doctors and medical professionals are regarding the vaccine. But then we allow people to make up their own mind about this, right? Pretty important that we have agency and use some critical thinking here. Some of the other infrastructure things I've thought about, the labs that we've outfitted. These are labs that, we have a variety of scientific equipment, of course, but this has allowed us to invest in some additional equipment that will long outlive the coronavirus, that will help us in, the natural sciences, biological sciences, engineering, and otherwise, where a variety of pieces of equipment that, frankly, we wouldn't have been able to get. I think about our local federal mineral lease district grants, and some of the other grants from the state of Colorado, that we've been able to use those dollars to help support equipment and infrastructure that's going to allow us to frankly improve what we're doing for years and years to come, right?
The educational experience for students will continue to live on in our classrooms because of this equipment that we were able to purchase in the time of the pandemic.
Yeah, the wastewater testing, the engineers pointed out, maybe obvious to everybody, but we can actually also, in addition to coronavirus, we can be monitoring for influenza. And so we're going to be exploring that concept as we bring in and upgrade some new equipment there that'll, again, allow us some insight into that, which is, just a real great blessing.
It is. I appreciated the comment about, how can we continue to get better? And maybe talking a little bit about the process, John, on what we're currently doing in committees and reconvening where we started back in the fall to make sure that spring is as optimized as possible.
Yeah, so all these committees, right, hundreds of people across campus are actively right now. In fact, a lot of the drafts are already coming in for our executive committee to review. And what they're doing is going through the process that we all go through, which is pause, look at what we laid out for our plan, look at all the protocols we put in place. What of that went well and worked? And what are the pieces that we thought would work that didn't? And so going through those things, big and small, all the way through every area, from from dining to the library to recreation and intramurals, all of it, to really look at how do we take what we learned and get better. And so that process is actually happening in real time. We've already had a lot of that committee work accomplished, and so now it's going through vetting that and then implementing here over the few short weeks that we'll have for the break before we start bringing students back. That's January 4th.
Oh man, it's going to be here before
right
we know it.
Right around the corner.
Yeah, that's exactly right. Yeah, and I think about some of the optimization we're doing and, some of the things that are going to stick around. One of the pieces with testing is, we've gone through nasal swab, and you touched on the fact that we have LAMP, which is that quicker saliva test. We also have another one, Saliva Direct, which is a PCR saliva test. I think some of the questions come in around, well, how valid are they, and how specific and sensitive are these tests that we're doing? And I will say the nasal swab continues to be the gold standard of what we know for testing sensitivity and specificity, but we also know that these other saliva-based tests are also very useful. The LAMP test will continue to be a screening test because we can get that quick turnaround. We can do it here in our lab, and the sensitivity is good enough that we know that we're going to pick up someone who's potentially in that range of being able to transmit that virus to someone else, which is really important. The Saliva Direct test is very exciting. It's the Yale test, if you've heard of that one. And the really exciting piece of that one is we not only get the quick turnaround, but it has the PCR test validity with it, meaning it's very sensitive and very specific for coronavirus. And so I think that's where I also look at the excitement for not only continuing to expand, but we're going to continue to look at what new technology is coming down the pipes for continuing to keep us safe as possible.
Yeah, the other thing I think about the Saliva Direct that's exciting is that it's right here in Colorado. And so, that those tests are literally turning around a few hours away. And so our ability to get test results in less than 24 hours, which is, rewind 5 months. If you would have told us that we could get test results, PCR test results in under 24 hours, right, we would have said you were trying to sell us something, but here we are. And so credit to the team and technology and innovation. And that's where we're at. And so we, I think, can anticipate that more and more of the saliva tests will be utilized, right, as we get faster and more active with those.
That's exactly right. And I think it's important to remember, as we said in the beginning, testing is not a silver bullet. We know that it is not perfect. We know it gives us one snapshot in time, but we do know it's an important part of our testing strategy, and we continue to see that validity of the testing with all of our external partners as well. So COVID Check Colorado is, walked with us hand in hand as we've gone through these different sort of testing strategies. I also think about the Broad Institute, MIT and Harvard, and Dr. Sabetti and her team, who continue to be in the boat with us and advise us on best practices and what's going to be the best for our campus community. So we could not have done it without all of them, but I think it's good to remember testing is only one piece of it, and we've continued to say that the safety strategy means a lot more layers.
Yeah, the layering metaphor is the right one from my experience too, because you know, as we think about all the various things, we really didn't even touch on the fact, and we have to, the custodians and the work that those folks have done to keep this place safe day in and day out, showing up and keeping, I don't know about you, but every day our team is coming in and wiping doorknobs, high-touch surfaces, making sure bathrooms and all the things that allow us to continue to stay safe. And it starts there, right? We're going to do sanitization, we're going to do cleaning practices, we're all going to take personal responsibility, and then leveraging all these additional technologies to stay on top of it, right?
That's right. Yeah. And I think one of the most powerful tools being an educational institution is just that education. I think about the COVID 101 course and where we began, and just a really good understanding of infectious disease and what does that mean and how we can protect ourselves. I think if a good thing can come out of that, I think it is this, that, we have a greater understanding of infectious disease and transmission, and how do we go about keeping not only ourselves safe, but doing that for our entire Mavily.
Yeah, one of the conversations I've had with a variety of students as we were winding down is, we know you told us that this was potentially a problem, and sure enough, as we saw those cases spike, students started to hit home for a variety of students. And so while that's certainly not the outcome we wanted, we're hoping that one of the positive silver linings of the surge in cases we had prior to Thanksgiving is students really having had a more personal experience to say, my goodness, I in fact can have an outcome here to help keep others safe, and my
That's right.
choices are going to affect the broader community. So, you know, as we work through those things, I think that is fundamentally the nature of education, right?
Yep.
Is we're taking young adults and providing them with the experiences and education to grow and become those young leaders that we want them to be.
Yeah, absolutely. And I think about some of the learning that we're doing just around the coronavirus too on our campus. We had a symptom severity survey that we sent out to folks that had tested positive and had experienced COVID on our campus. And of those respondents, you know, really learning that over 80% of folks really rated their symptoms. Obviously, it is an anecdotal. I'm doing a self-rating of what I felt like, but really rated their symptoms as very, very mild symptoms. And you know, I think it's hard to remember, you know, the greater impact to the community and really what it means to be a community member when maybe we're not as impacted, but continuing to remember the vulnerable populations that can be. I think is a big learning piece that came out of this.
Yeah, we know this from our congregate care facilities in town, that assisted living and senior living facilities that that have been so devastated over the last number of weeks. And the commonality is that while young people tend to have no or low symptom severity, the places in which they work and the family members that they live with could be impacted and in a high-risk area. So great reminder for all of us to continue to be doing everything we can to keep each other safe, right?
That's right. So we've been talking about spring and optimization, but we still have a really important celebration that's going to be happening here, commencement, and certainly worth mentioning, and I think probably worth
4
talking
years of
about.
work, right?
It's huge,
Yeah.
yes, an important thing to celebrate, and our strategy around how we're going to be able to do that right here.
Another example of the really strong partnership that we've built with Mesa County Public Health, you know, 9 months of trust really manifesting itself next Friday, which is to say very few people are going to get to enjoy the celebration of 4 years of very hard work and really a life milestone. But our winter graduates will. And the reason they will is because Mesa County has partnered with us to come up with a strategy. It will look a little different, but utilizing test results. So everybody that attends, from, you know, the president and you and me and everybody else that's there, students as well as guests, parents and others, will all need to get a test in the few days leading up to it. So you've had, if your student is a winter graduate, they've been getting emails and information about this. So both they and their 2 guests, and that's all that will be allowed is 2 guests per graduate, need to have a negative test. And so we're working with our partners to have all that work done. Our labs have scaled up so that we can manage this additional output. And what that really means is that by taking this additional extra safety step, we are going to be able to get people together to celebrate this really life milestone in the midst of a difficult circumstance. Wouldn't be possible without our testing capabilities, our partners, and the help and guidance from Mesa County Public Health.
That's exactly right. And I think remembering it is going to feel a little different. Those social distancing, wearing masks, that's all going to be in place. Those safety practices that we know are so important. But we are thankful that being able to add testing to that strategy is really going to allow us to be able to honor those that have put in a lot of hard work, and to be able to do that even if a little bit different.
Yeah, big day, and we're sure grateful that that's still going to be able to be celebrated despite a difficult time. And looking at my fancy iPhone, it appears that the weather is going to be nice. So Grand Junction will be sunny and in the 40s if
It's going to be perfect.
if our weatherman is telling the truth. So it should be a really lovely day. But do reach out, check the commencement website, reach out to safety@coloradomesa.edu if you have questions about that. But vital that you get your tests in advance, a couple days out, so that we can get those turned, and then that'll be validated upon entry that you have a negative test.
That's right.
Don't show up without a negative test.
Please don't. Yes. As we continue to think about the future is now, optimization, continuing to have students back in the spring. What do you look forward to? What do you hope for as we continue to think about what that's going to look like?
Well, you think about some of these things that we went through with bated breath in the fall, and we're pretty good at them now. I'm excited that the semester, I think we're all anticipating is going to be a little inverted. You know, this semester the community incidence was really low, our campus incidence was really low when we started, and we were all sort of waiting and dreading as the weather got colder and cases started to rise. And here we are heading out into January, and we know it's actually the exact opposite. And so from a psychological standpoint, knowing that as the weather warms and as the semester progresses, we fully anticipate things are going to get better and better and better, not to mention the prospect of a vaccine. And so I'm really excited that we're going to go into this equipped with all of this new learning experiences, technology, and better protocols even than what served us well this semester.
That's right.
And knowing that heading into this semester, we stand a really good chance of having an even better semester than we did in the fall.
That's right. Yep.
That's not nothing.
That it's absolutely not. And I think, one of the important pieces that you hit on is how important you all were, parents, faculty, staff, students, in making this successful. And you will be an important and integral piece of making this successful again. So if you have thoughts about how this can be improved, what went well, what could be better, please send us that communication. You can send us an email at safety@coloradomesa.edu. That's a great way for us to hear from you, our partners in this.
Yeah, I think we're doing this internally, our staffs, each department, each unit, faculty, we're all having this moment of reflection and saying, okay, let's be really hard on ourselves, constructively critical, and say, what really do we need to do better? So take a minute and do the same for us, if you will. Extend us that courtesy and help us get better. Send us a note, safety@coloradomesa.edu, and help us get better. I saw Chantella saying that her son made it home safely with a negative test. We're grateful for that, Chantella, and I'll tell you, that came as a result of conversation with our partners saying, look, as things rise, we need to be ready for spooling up our testing in a major way before we send students out to ensure they have negative tests. So that was not our genius idea. That was really, again, back to our medical and public health advisory panel saying, here's one of the elements you need to have in place. And we did. And so we're glad to see that.
Absolutely.
That worked.
Yeah, it's fun to be able to see protocols, process working, and we know that we can continue to improve those. And I think as students begin to head back this spring, we start thinking about ramping up testing again as we continue to test everyone before they come back on campus. I think that is going to be great to be able to see us flexing those muscles, and we hope that this process is even better this next time around.
Yeah, so let's be specific about that. We know that the baseline testing before we come back to campus will happen again. That worked for us. If you'll recall, we caught 37 cases who were asymptomatic, had no idea they were infected, and we were able to catch those cases prior to fall semester because we tested in advance of the semester, all 10,000 of us. We're going to do the exact same thing in January. All of us will come back to campus, but we'll have to have a negative test before we're allowed to return. So what you're going to see as parents and students is the same kind of opportunity. If you live in the Denver metro area, I think we have something like 12 or 14 sites over there with our partners now where you'll be able to test a few days before coming back. If you live here in Grand Junction, our testing site on campus will be available to you. And if you're out of state, we are going to do something different. So let me point one thing out. Our mail kits from the fall, despite our best intentions and efforts, did not work very well. So we are not going to do mail kits again. That's one of those lessons learned between the shipping and it just did not work well. So what we're going to do is ask you, if you're able to get a test at home reliably in another state, please do that. If you're not, travel to Grand Junction, and what we'll do is we will make sure that you are one of the number of students who have access to a same-day test. We'll screen them for a same-day initiative before we allow students to move back in, and then we'll also give them a PCR test that we have the confidence that they are in fact negative prior to moving in.
Yep. And I will just add on, based on the CDC recommendations, if you have tested positive in the last 90 days,
That's right.
you do not need to retest. So there will be a platform for you to be able to upload those test results, and you do not need to test again, just because we know that viral shedding, that you can still test positive even though you are not symptomatic or someone that's going to transmit the virus to someone else. So we are aware of that. So if you have specific questions, you can always email us at safety@coloradomesa.edu, and we can get back to you with specifics on individual questions.
Yep. So just to be clear, come January, you'll get a test unless you have tested positive in the last 90 days. And I think if my counting is right, that's somewhere in the early October timeframe.
Yep.
If they have been positive for coronavirus from the early October timeframe forward, basically,
Yep.
then they won't have to retest. All the rest of us will need to go get a negative test again. And that, by the way, that'll be staff, that'll be faculty, as well as students, so that as we come back together in late January, that we all have the same confidence we had heading into the semester.
That's right.
With negative test results.
Absolutely. Yes, that's
Here
a
we
lot to
go.
think about.
It's a
Here we
lot.
go.
Well, we're sure grateful for so many, the hundreds and hundreds of faculty and staff and others who help make this possible, to students for believing in us, for trusting in us, and for showing leadership yourselves and making good choices and holding each other accountable. To you parents who have been partners with us, helped us get better, trusted us with your student, and continue to help us get better. Thank you. We're grateful for that. We're as excited as we've ever been about heading into this next semester,
Absolutely.
being one of the institutions that is just absolutely committed to this, frankly, from that same moral imperative.
That's right. Grounded in science, but so thankful to have so many people on the boat
Yeah.
rowing with us that have helped help us to make great decisions,
Yeah.
as we did in the fall and we'll continue to do in the spring.
Don't know what the future holds, but we know that we're ready. We're prepared. We're going to continue to take the same approach that we have. So thanks for sticking with us. Thanks for checking in on this weekly update. This will be our last update until after the new year.
Yep.
I'm going to miss all of our friends here in the room and all of you online, part of our Facebook friend community. We appreciate you sticking with us, and we'll see you after the beginning of the year.
See you in the new year.